So thank you, Alison, for that introduction, and thank you everyone for having me. So today I'm going to talk about one of all of our favourite topics at Clovelly is neonatal foals. So this week we've got some babies back in, and we're all getting quite excited again about the breeding season. But certainly, you know, that information which you tucked in the back of your brain in December needs some dusting off of the cobwebs. So today we're going to do that and look again at how we assess these neonates. I'm going to go through some different things in this presentation. So first things are red flags. When should we consider that our neonate might be at risk of becoming ill and be looking at it more closely? What are the normal milestones? How do we do a physical exam of a neonate? What are some of the common diagnostic tests you do on farm? And when should you seek for help? And then I would love to invite any questions that you might have. So I know looking around this room, certainly at this level we have people with a vast amount of experience. I would love to count up how many foals have been seen by the people in this room. I think it would be quite staggering. But also I know that we have a range of people with very extensive experience and some who've just transitioned into the department of working with foals. So today, going through my talk, for the more experienced people in the room, I probably won't be telling you anything that you don't know. Nothing is particularly new or groundbreaking in assessing a foal. But I'm hoping for the newer members of the group, I might just be able to provide them a system to look for and some things to be aware of. I might just stop. I have a lot of feedback. Excellent. Oh, that's much better, not listening to myself. Which those of you who've never met me, I do know I sound about 12 on the phone when I call you with updates. So for our newer members, I want to provide you with a bit of a structure of how do you assess your foals, what should you be looking for. For the more experienced members, I think this is a really good opportunity, like I said, just to brush up your knowledge, but more to think about how are you training your new hires this year? The ones who've never seen a new foal before, how are you telling them what to look for and when they should call you? So here you can see my 2020 new hire, Nutmeg, and I watching a breeding seminar together, brushing off my knowledge and making sure she was trained up to help with all those weekend and midnight reports that we send you via email. So because of that, how I'm going to approach this talk is how I train our vet students and interns and how I examine any patient that walks through the door regardless of age. So first we get a history, we then look at the animal from a distance, we then put our hands on the animal and do a physical, we then decide do we need to do any diagnostic test or do we need to call somebody else. So in your situation, does that mean you need to call somebody within your farm who has particular expertise in this area? Do you need to call a vet in, and when do we make those decisions? So for every single case, history is important, and I don't think that is any different if you're working on the farm or if you're working in a vet clinic. For you who have really routine or sort of populations of stud mares that have lived on your stud for years, you're going to know them extremely well and know their history. But for ones that have just turned up this season, I'm sure all of your clients are similar to some of our clients. Sometimes you get no history whatsoever. You might get, oh, the old owner told me she had a dead foal 3 years ago. Zip, that's all you know. Or you might get some really detailed history. And for me, where this history is important is how do you categorise your foals? So we're talking about assessing the neonates. How do you organise this on your farm? So looking at our history, do we go, this is going to be a high-risk neonate, this is going to be middle risk, this is going to be low risk? If it's a high-risk neonate, do you automatically have a protocol in place? Will that foal get a full blood? Will it get checked by a vet the day it's born? Then will it maybe get some more frequent observations during that first week? If it's a middle risk, maybe it just gets an IgG and more frequent observations. If it's a low risk, if everything's fine at birth, you just treat it exactly the same as all the foals from the healthy mares. So that to me is where history comes into place, is raising those red flags, letting me know that potentially this foal is going to be compromised. So the first thing is just routine husbandry, all the things that you do day in, day out, but particularly if you get a new mare just to foal down. What's her vaccination history? What's her deworming history? Has she had any big changes in management? So you need to just be keeping a close eye on her, say for colic or other problems around foaling. Similarly, what has happened either on your farm or on the farm she's come from? Have we had a problem that year with, say, abortions due to caterpillars or due to psittacosis? Certainly that may raise your index of suspicion there could be a problem with the foal. But if we have had some potential psittacosis cases, also how you manage your staff and being really careful with your own personal protection, that we're not exposing ourselves to anything that we can breathe in during the foaling process. Secondly, do we have history of prior pregnancies? This is where we love thoroughbred mares. We have a stud book. It's very different when you get a lot of stock horses, Arabians, warm bloods in the door to even work out when they got bred, what is their potential gestational length, have they had other foals before? So just all those routine things that are good to know. Is this a maiden? Will that affect how you assess her? Will that affect what you expect the foal will look like when it comes out? Has she had previous injuries? Has she had previous sick foals? Do we know why they were sick? So do we know that she's previously had NI foals and say that foal might then go through a different protocol? Do we just know that she lost a foal after birth but have no other history? So, you know, that could be anything from a lightning strike to she had placentitis and the foal was septic, so you might need to watch that a bit more closely. As we know, mares tend to stick to their own normal gestational length. So if we have that history available of when they foaled in other years, that can really help us to know, is this foal bang on time for this mare, or is it actually significantly overdue or significantly premature, with our just average cutoff being 340 of a normal gestational length and 320 for prematurity. Then we need to think about the mare, because if there is no mare, there is obviously no foal. So what's happened to that mare during pregnancy? Has she had complete smooth sailing? Has she had just some minor problems, so something like a simple eye ulcer which healed, which is unlikely to influence the foal? Or has she been significantly ill? So things like needing a colic surgery, being very sick with a pneumonia or colitis, particularly having chronic orthopaedic pain, so problems like laminitis. In two ways, that will automatically put our foal in that high risk category. So first is going to be that the mare herself is sick. So how she is able to support the foal through the blood flow, through the nutrients and all those hormonal changes which tell our foal it's ready to be born at a certain time. All of those might be affected. The second thing is that she's likely to have been on a lot of different medications which can influence the foal. So like this mare in the top picture here, she had a very significant orthopaedic problem, which happened quite in advance of foaling. She was on a lot of drugs. We were quite concerned about the foal. And this is one where all those red flags pay off. We watched the foal perfectly, nothing happened, it was great, it counted off home, which is the best outcome. But we were right there on the ground to watch it to make sure it didn't deteriorate, or if it did, we could catch it early and intervene. So that is non-reproductive illnesses. Then of course, we're talking about pregnancy, we're talking about foals, we need to know what's happened in that uterine environment. In some of these mares, you're going to have a lot of history, a lot of information. So have they been a mare with a previous placentitis that you've been monitoring closely? She's had a lot of ultrasounds, a lot of blood tests, she's been on different treatment, you know what's going on. In those mares, do you have any swabs or culture results? Because if you have those, that can be really helpful if the foal is to get ill, to know what our antibiotic choice might be. Or did she have some complications during pregnancy that you're completely unaware of because the mare's just rocked up on your farm to foal and you've got no history whatsoever? Or did something just happen in the day or two prior to foaling? You noticed her running some milk, but she didn't have particular interventions in place. Sometimes, as we know, we don't know there's been any particular complication until the foal comes out. So to me, training your new staff particularly in how they observe, how they record a foaling, how they examine a placenta, when they call you for help, is really key to assessing the foal during those first few days of their life. So we can have particular problems during foaling, so obvious ones like a red bag. We can have unsupervised foalings no matter how well we plan, which this poor mare you can see up there had a lot of trauma. And for our mare, if they've gone through this difficult foaling, if they have simple complications post-foaling, just like a retained tag, or if they have the risk of really serious complications like a bleed, that very much is going to flow into the foal. It's going to affect our milk production, it's going to affect the bond between the mare and the foal, and so as well as looking after our mare, we're going to have to really watch our foal too. Then we all love to look at placental membranes and talk about those. So just really making sure that your staff know what does a normal placenta look like. They can be confident that both the horns have come out, but also do you have a big bank of abnormal things to look at? So you can show them what it's like to have a meconium stained amnion, to have changes there in the vessels. Is there a lot of discharge? And if that placenta is abnormal, maybe popping it in a bucket to show it to the vet so they can have a look too, and you can decide if you do some more testing. But looking at the placenta can give us lots of information about what the disease process is and what we might need to watch for in our foal. And finally, once the foaling has occurred, checking the colostrum quality of the mare. So visibly looking at it, making sure it's nice and thick and yellow, but preferably also looking with your refractometer to make sure it has a nice high Brix level there too. So now our foal is on the ground. First thing first, we just need to know all our normal values. And I know you all know what a normal foal looks like, but making sure that you have these set things in place so your foaling attendants know what is normal and what are their cut-offs when they should call for help. Or if some of these things were slightly abnormal, do you need then to go and look at that foal more closely the next day? So we want our foal to be born. We want it to sit up in sternal quite soon. We want it to be interacting with us and interacting with its mare. We then want it to have a good suckle reflex, because without that suckle reflex, we really can't be looking forward to nursing it effectively. Within an hour, we'd like the foal to be standing on its feet. Within 2 hours, we would like it to have nursed. Then we want it to pass meconium and to pass some urine. So passing meconium is, funnily enough, one of those history things which often no one thinks about, but can become really important if the foal is sick down the road. So do your first time foaling attendants know how much meconium should the foal pass? If they say, oh yeah, it passed its meconium, and it's 1 or 2 little balls, well, that's not enough. You know, we want nice big double handfuls. Was it formed? Was it nice and sticky and normal? Or has the foal been born in a sea of meconium diarrhea, in which case we might not actually expect it to pass formed balls of meconium. Similarly, we want them to know what does normal urine look like in a foal. So remembering that urination actually happens a bit later than passing the meconium. I've put up there 6 to 18 hours because that tends to be the range when we see a first urination. Interestingly, when they do averages of just watching lots of foals, colts tend to urinate earlier than fillies, so about 6 hours, and fillies closer to the 12-hour mark. In the normal foal, the first urine that they pass is going to be nice and concentrated. So clearly my image is not a normal foal urinating, that is a foal with a ruptured bladder, but it's got all that first urine sitting in its abdomen, which we're draining out. And you can see in my pot there, it's a dark yellow colour. Once they start nursing from the mare, we really want in the next few days of life them to be urinating very, very clear urine that just looks like water. So if your foal isn't frequently urinating urine that looks like water, maybe we have a problem. Or on the flip side, what about the foal that gets born and an hour later is already urinating? That also is probably a signal that something might be wrong with that foal, because the messages between the mare and the foal telling it it's time to get ready, it's time to get ready for birth, your kidneys need to turn over to work on their own, maybe they actually started happening a few days or a few weeks earlier because there was a placental problem. So really early urination often isn't normal. Not urinating at all, clearly a problem, or failing to pass nice clear urine as the days progress. So our next step is exam from a distance. Certainly the most experienced people in this group and the ones on your farm are the ones that can just walk to the gatepost, look at that foal and go, that's not right. You don't even have a particular reason. You just know, looking at that, there's something going on and you need to look further. I like to make sure that we go through every single little process, especially with our younger vets, and they're not allowed in that box until they've looked at everything, no matter how eager they are. So things we're looking at before we really get in there and we interact with the mare and the foal. What is their bond? We want our mare to have a good bond with the foal. We want them to be close together. We want her to be looking for where her foal is, encouraging it to nurse. If there's a problem with the mare-foal bond, then similarly that's going to raise your index of suspicion of things you're looking for in the foal. Is she just a maiden? Has she got a bit of a sore udder? Do they need a little bit of TLC to get the foal nursing properly that day? Is the mare really rejecting her foal, which luckily we don't see that often, but is the foal at risk of being damaged? At that point, do we need to escalate this a bit further and maybe consider, say, drug protocols, very much supervised nursing situation, or in the rare case scenario, a foster? So for both of these sort of scenarios, one big thing we have to think about in the foal is if this has been going on, whether it's the low-grade maiden who doesn't know what's happened, the mare who is normally a really good mother but this year doesn't seem interested in the foal, or the one that's attacking her foal, we need to look at the combo. So on the mare side, particularly if you know she's normally really attentive and she's not, maybe she's a really, really stoic thoroughbred broodmare who's started to bleed internally, who's starting to get septic from a retained horn, who's starting to colic, and you need to look at her because she's just standing there being introspective without showing obvious signs yet. Regardless of which scenario we have, the foal probably hasn't drunk enough, so it's probably dehydrated, and quite possibly it's not going to pass its IgG because it hasn't got enough colostrum. So then from the gatepost or the outside of the stable, we look at the foal itself. So what does the foal appear like externally? Is it a really big 75 kilo healthy strong colt, which is awesome, but does that mean we need to make sure that mare gets a really good repro exam that day because possibly internally she's got some damage going on? Does the foal have signs of prematurity or dysmaturity? So remembering dysmaturity is when they stay in too long, so they're overcooked. So those mares that say go out to 360 days, but we still have those same signs as the premature ones. So very small, they can have a silky hair coat. Like our foal here, we have a domed forehead. We can have either really floppy ears or the really curly tipped ears, and we can have laxity of our tendons. So for those foals, do we need to think about things like checking their ossification or making sure that they continue to kick on as the days progress? Do we have any evidence on the foals? So after day one, once we're getting through, our first week, is the foal starting to get some signs that it's been spending too much time down? So this foal in the middle has some pressure sores. So it arrived with these pressure sores and it had just been spending longer than it should down. It was, I think at this stage, 5 to 6 days old, so it was managing to hydrate itself, but it definitely wasn't a healthy foal and needed some help. And the first sign of that you'll usually see in foals is these really focal sweat patches. So they'll just have little wet circles over the bony points, so over the elbows, the hips, before they actually turn into wounds. Do we have other wounds? So, has the foal got itself underneath the mare's leg or into the fence or anything else we can see from the outside? And here we have a very nice big distended belly of another foal with a ruptured bladder. So can you see obviously from the outside that they're looking much rounder than they should? So we've talked about the mare and how she's attentive to the foal, but the next thing we look at is the foal's mentation. So what is its brain doing? As much as the mare should love the foal should also love the mare. And one of the very first signs that we'll see in those dummy foals that are born normally, look fine on day one, maybe day two, is that they can lose affinity for the mare. So rather than wanting to go to the mare, get up, nurse, play, sit down, they'll just start to wander off in corners and not pay attention to the mare. Even if you catch her, bring her over to them, they just don't seem to recognise who she is anymore or that they're meant to be a happy pair. So we want our little foal to have nice pricked ears and look happy and healthy like on the left, and to know that it should immediately go up and nurse. So like I said, one of the first things we can see is just that loss of affinity for the mare. Foals will often start to go into the corner of boxes or go up to a feed bin and start to nurse on that or hug up to that as opposed to their mother. The most extreme loss of mentation would be unconsciousness, like our foal in the middle. But in between bright and healthy and unconscious, there's a whole lot of other very subtle abnormal neurologic signs you might see. So they might be doing a bit of stargazing. They might be extremely tired when they're down. They take a lot for you to wake them up and then they bounce off and seem normal. But the next second they're really down, deeply asleep again. they might be falling asleep on their feet. So they're using the mare, you know, as a table like this. They're sitting in the lecture like you all will be by the end. Because they've forgotten that they're meant to lie down. You'll lie them down, they'll pop straight up again, they'll forget again, and they're asleep on their feet. Seizure activity is a big problem in our foals. So that might be full-blown seizures, which, you know, they're down, they're paddling, they're stiff. Or sometimes they get focal seizures. So these mild dummies might have gone okay for the first couple of days, but you'll notice that they're just twitching in ear, that they're chewing in their mouth, that they have a bit of a repetitive movement on their leg. That's definitely something to signal that you need to look at this foal closer. You can see our foal with its tongue stuck out. I'm sure you've all seen many of foals with their tongue stuck out to the side. It seems to be one of our signs of a dummy foal that even after they get much better, it just takes them a long time to realise their tongue goes back in. But that's a good, easy one for your staff to recognise as not normal. So next thing is, how are they moving? You know, we want them easily getting up, easily getting down, bouncing, bucking, playing. If they're not doing that, why is that? So it might be that their brain isn't working, but it might be that it's actually painful for them to get up and down or to move like they should. That could be like in the middle, because we actually have some problems with the foal's conformation. So say it's very lax or it's very contracted. As they get into that later neonatal period, so in our first week 2, 3, we might be getting some septic joints, which always aren't obvious. It's not always a big fat leg. Maybe the infection's in our neck or in their spine, so they might bunny hop, or they might be really reluctant to move their neck, which is an important part of getting up and down. So being reluctant to move or just standing in an abnormal posture is another key indicator we need to put our hands on this foal. And then also, are they really frequently posturing to urinate or to pass feces, their tail up in the air, they're squatting, they stop, they start again, because that's probably an indication we've got something going wrong there, either with our guts or with our bladder or kidneys. So now I would tell the interns they're allowed in the box, but they still can't touch that cute foal. So the biggest thing to look at is nursing. And you know, we've all done it. We've stood at the door and gone, oh, that foal's nursing really well. But until you crouch down, you have your head underneath there, you have no idea if that foal is nursing effectively. So making sure your staff know that. You know, my foal there on the left quite possibly could just be sucking the side of the udder. It could be chewing its own lip. It could be lapping the milk that the really good mare is just streaming down on it without actually having a good tongue seal. So we really want that beautiful tongue seal in the middle. We don't want any noise, so we don't want any gurgling, any spluttering, any coughing. And then once they finish nursing, we don't want to see milk coming out of their nose. I don't think this video is going to work. I did have a beautiful video of a cleft palate. No, where he wasn't quite typical. So rather than just getting the milk out of the nose, this foal was a bit older, so it had learnt to compensate. So if you looked under there, it looked like it had a ginormous milk moustache because it couldn't effectively swallow. It'd walk off and a few minutes later go with milk just spraying out everywhere. So making sure you're watching that whole nursing procedure. And if we're having aspiration, definitely we need to look closer. You know, it might just be a bit of a dummy that needs to get smarter about swallowing, but maybe we have a cleft palate. We occasionally get other abnormal congenital problems, so cysts in the back of their throat, which can stop them swallowing properly, which we can only find with a scope. And the other thing before you touch the foal is looking at their respiratory rate and effort, because as soon as we touch foals, they get excited, they start to puff. So looking what they're doing without your hands on them. And sorry, I think this video won't work either. This was just a foal with really big respiratory effort. But are they really flaring their nostrils? Are they moving their abdomen as well as their chest? Do they seem to tire very easily when they get up to play? Because that might be indicating either it's part of our dummy foal syndrome, so their brain isn't telling them when they should breathe appropriately, or maybe it's a problem with our lungs. Oh, it wants to work. I don't know why the other one didn't. So you can see its little nostril flaring under there. This foal had very big problems with its lungs from just after it was born. And we certainly see this in our septic foals. We might see it in foals that have aspirated meconium during delivery. We certainly need to be worried about psittacosis foals if their lungs aren't behaving normally. So now we've had a look at our foal. Then we need to really do some triage. If the foal looks fine from a distance or there's something minor, then that's great. You know, we've got time to look at it, evaluate it. If our foal is collapsed, you know, you get the call from whoever's attended the foaling or the next night and it's down and poorly responsive, then this is where you just do your rapid fire assessment and work out what do we do next. So the things we look at, you know, this is a physical exam which takes less than a minute. Can the foal stand up at all? So is it lying down there but it's just, you know, in that sort of deep sleep, maybe abnormal mentation but can get up, or it doesn't have that ability at all? What is its colour? If it's completely white, that is a very bad thing. You know, we'd vastly prefer they are pink of any arrangement. Or is it blue? Also very bad thing. What's our heart rate and rhythm? So is our heart rate really, really slow? So is it lower than 60 in our neonates? That isn't normal. Or is it very, very high? When we touch them and examine them, you know, their heart rate can jump up. But are we over 150, getting up to 200, and is it really irregular? When you listen to it, is it going ding, 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 as opposed to a regular rhythm? Because that's not normal. We've already spoken about our respiratory rate and effort. So some of our foals forget to breathe. So are they actually lying there? You don't see any breaths. You stimulate them and they take a big breath. Not normal. Do they have really shallow breaths? And if you try and look for movement or feel for movement out of their nose, you're not actually really getting much at all. Or are they breathing very, very hard? And often those will be your blue foals that are trying really hard, but their lungs aren't working to get the oxygen and you notice that they're blue. And then we can also check their temperature. So I would be more concerned in a neonatal foal if their temperature was really low as opposed to a fever in terms of needing to do something straight away. So our normal foals will be between 37 and 38.6 Celsius. So if we're below 37, particularly below 36.5, I'm worried about that foal circulation. So any of those things that we're really worried about, immediately you're on the phone to the vet, and if you've got oxygen there, putting oxygen up its nose. If you're really worried about that respiratory rate and effort, I also just like to sit them up. So sit them up and hold their nose out, help those little lungs expand until we can do some more intervention. If they're not, well then we move on to our more thorough exam of the foal. So every single time I do a nose to tail examination, because it means when you know you're looking at the foal, you've got the vet at the crush going, where are you? You've got the client on the phone, you've got something else foaling, you are doing the same thing every single time and you're not likely to miss something abnormal. If the foal is normal, this whole exam may take you 1 minute. If it's not, then we're going to go more slowly and look really closely. So I start on the head. There is a wealth of information that we can see on foals' heads, which we probably don't actually get from adults. So I really pay attention to what's going on down there. We've already spoken about their brains, so that's obviously part of their head. But then we want to look on their skin. Do they have some abrasions there on their skin? So was the foal down maybe during the night and we didn't know? Maybe did it have some colic? Has the mare potentially been getting in with the foal, or once they're in with another group, has there been some argy-bargy going on? Do we have milk staining on the face? So is this a foal that from outside the yard looked like it was nursing, but actually it was just standing under the udder and she was just streaming milk on it? Or is it a foal that's completely capable of nursing? It's not a dummy, but it's feeling really sick and it's gone off suck, and so it's going to have a milk-stained face. I've briefly touched on mucous membranes and I'll show you some photos next. So looking at the colour, are they nice and moist? If we touch them, do they refill with blood? Do we have any petechial hemorrhages? So they're all the tiny little dots. And in foals, which we don't tend to look in adults, we look in their ears, we look in their nostrils, as well as their mouth. Because all those little tiny diddy dots can be a good sign of sepsis with changes in blood flow and clotting. Another great thing we can see on our foals is their little coronary bands will often turn quite red in the septic foals too, which is something we can't see in an adult. On their face, we can see some congenital abnormalities. So the cleft palate we might notice because we hear coughing after nursing or see milk from the nose. And do they have a parent mouth as well? So looking at their teeth and their jaw. What's their suckle response? So if we've got nice clean hands or gloves on, putting a finger in there and feeling if they can suck on our finger effectively. Looking in their mouth, so quite often, you know, especially if these foals have been a bit compromised, they might have been sort of flailing around or rubbing around, and they can just really easily upset their mouth. Or if they're that little bit older, a week or two, they're not nursing effectively, or they're sick, they can get candida, so that really sort of furry, fluffy, fungal look in their mouth. And that alone, I think, can be quite uncomfortable or painful and just get that whole cycle of not wanting to nurse going. And then similarly, we just pop our fingers in front of their noses, making sure that they're passing air through both nostrils. So some things we're looking for, I don't know if you can see from your seats, but there's a whole lot of those little red hemorrhages in the ear of that foal. That was a very septic foal. In the middle, we have a foal which had been colicking very dramatically, and with their little fragile skin, foals are very good at rubbing the skin off their face. And then we have a milk-stained foal on the right. And then here's a range of our mucous membranes. So if I saw the foal on the left, I'd be quite worried. That foal is very pale. We look at our next one and it's starting to go pale yellow. So if we have pale yellow, common things being common, I would worry about NI, I'd worry about sepsis, and I'd also worry about meconium retention if it's one of our younger foals, because they can actually absorb some of those pigments from that really dark meconium, and they can start to go jaundice too. I prefer the foal in the middle. I mean, I don't, it's very orange, but it's orange, so it's pink and yellow, which is probably nicer than white and yellow. But that's definitely going to tell you want to do some bloods on this foal and get the vet involved as well. Here you can see a foal that has extremely poor blood flow. So we've touched those gums and you can see where our finger was. That mark has not gone away in the time it took someone to go, oh, look at these mucous membranes, and take a photo. So very abnormal. And the pink colour itself is really more purple pink, so we don't have that good effective blood flow and transfer of oxygen around the body. And then the foal sticking its tongue at you similarly has some beautiful petechial hemorrhages, those dots all over its lips, or its inside of its lips rather. And then the foal on the bottom has those abrasions in its mouth, and we can see this sometimes in our foals which are a bit dummy, where their mouths just dry out. You know, they're sort of lying down, they're flopping, their lips are floppy. They're not effectively constantly chewing and bathing their mouth, so they can get these quite horrible dried out lesions. So next thing on the face is the eyes. Any of you who know me know that I love eyes, so not hard for me to find eye photos in my stash. So things you can notice at the moment of birth sometimes are congenital abnormalities. This might not be something that you need to do anything about right now, but maybe it goes in your file of every time the mare comes through the crush for vetting, we look at those eyes and see what's going on. Maybe we get some advice, is this something which might need surgical intervention as they get older. At probably the worst end of the scale, we can have no eye or a really, really tiny little nub of an eye. Somewhere in the middle there, we can have quite a small eye, but still is functional, which is okay. But if it's small, maybe it's going to be at risk of ulceration if we're not properly sort of blinking, tearing. Do we have cataracts? They can just be tiny little dots, or they can be completely white and very obvious. Are the eyes sunken? So if our foal's dehydrated, they'll often be sunken back in their head. They don't have that big build-up of fat pad like the adults do behind their eye. Do they have any entropion? So that bottom lid which is curled in. You know, you can curl it out once, but if it goes back in, that's something that we're going to have to fix. What's the colour there of the conjunctivus? That's the pink part, and the sclera, which is the white part. Doesn't really tell us about the eye, but tells us maybe is our foal dehydrated, is it potentially jaundiced. Let's look at our corneas. So a lot of foals are born with eye problems. So we had a foal come in once for tiger eyes. That was its whole presenting complaint. It was born, it was healthy, it was nursing. The owner noticed that the eyes had turned bright green, and lucky they noticed because by that night it was down collapsed and on a bed because it was severely septic. So the eyes give us so many clues. They can be born with ulcers, they can have changes to the colour in the eye, they can have other signs of inflammation in the eye, so the cornea can look fine, but inside the eye you have those clumps of fibrin, all of which can be indications the foal was septic in utero. So other things there, so high femur, so bleeding in the anterior chamber. Maybe the foal had a really rough foaling and had a bit of squishing on the way out. That might be fine, but maybe we need to treat it. Pus, fibrin, other things, signs of infection. And looking at our pupils, if they're really fixed and dilated, maybe we've got something not quite working in our brain, or if they're really small and tight, maybe there's some eye pain that we need to treat. So we've got some different eyes up here. So the foal up on the left is a foal with NI. You can see it has fluorescent yellow sclera. The next foal has entropion. So if you look at that bottom lid, you can't see the eyelashes, it's all curled in. And that ulcer that the foal has is quite typical with entropions, because you can imagine those eyelashes are rubbing on the little fragile cornea. But you often only see those ulcers down the bottom if you really tip the foal's head. So this is going to need the foal to be inside for us to be noticing this and for it to be nice and quiet. Those superficial ulcers from entropions usually heal beautifully, but if they get a nasty infection, we need to get on top of it because racehorses need their eyes. The next foal has some edema. You can see it has bruising all in its eyelid and also its eyes really cloudy. So that's a foal that had a pretty tough foaling and just had some issues coming out with pressures there in its head. Our next foal has lots and lots of hemorrhage in its sclera. It was a very septic foal, so those red eyes also can be a sign of sepsis. Our foal down the bottom left, you can see its eye is blue, and I'm not sure if you can appreciate, but it actually has a whole lot of blood vessels up here. So this foal is just born. So the fact that all those blood vessels have grown tell us that this eye has been sick for several days, if not a week. So it's a good indication that even if this foal looks bright and bouncy today, we need to do some bloods, check the foal, because it's probably been having problems for quite a while in utero. Just another foal with injected membranes, but also has a lovely hedge of vessels coming down here. We've got two foals down here with congenital abnormalities. So quite often thoroughbreds, if you look closely, do have some of those funny little hairs in the corner of their eye, which don't grow long and don't cause a problem. If they're beautifully exuberant like this, maybe it's something we need to address. We can have congenital non-cancerous type growths on the side of the eye, which similarly is just something we need to work out. Are we going to do something about it in our neonate or later? And similarly, we can have congenital cataracts from those little dots to these really obvious white lenses. So we're done with the head. Then we need to move on to the neck. Not much to look at on the neck, but you know, we're going from our nose to our tail. So something we might notice, what's going on in the jugular. If this is a foal that had to have a few bloods or maybe needed some treatments, is that vein okay? Did it get a bit bruised? Is it clotted? Has it swollen? If it was a very well-behaved foal and you took blood like this foal up here, you do something else, you come back and look. This foal actually has a catheter in place, which is completely closed, and it had a clotting abnormality. So it was just excessively bleeding. So if you do have to bleed the foal and that happens, definitely we need to investigate a bit more what's going on. Or if you feel like you went in, came out really nicely and it blows up in a big bruise, maybe we need to look a bit further. Foals don't necessarily have the best sort of skin tints and those sorts of things, but I do like to raise their vein just briefly, make sure it fills, make sure it collapses, because if you can't raise it at all, that's probably a pretty good sign that they're dry and dehydrated. They can have congenital abnormalities in their neck, so the bad ones unfortunately probably are going to be seeing the vet at birth for your dystocia of the really abnormal wry necks, although I have had foals born alive with fused vertebra, which isn't reported commonly in thoroughbreds, but it can happen. So it's something which was only noticed at day 2 or 3 when the foal was a bit more active but wasn't, you know, moving normally. Do we have a really big thyroid? So usually not a problem for the foal, but it might be an indication of what's been going on in the mare and something we might need to look at. So like those old horses that get a really big lump there, occasionally we get foals born with big thyroids too. And is there any pain in their neck? So certainly once we're after that first day or 2, if we get foals with meningitis, their typical sort of sign is they'll be standing there quiet, you'll lift their neck up, they'll be so sore that they'll fall straight over on you. Or could any trauma have happened? So could our mare have stepped on the foal or have other issues? So now we're down to their chest. So the first thing I like to do is just feel across their ribs. Up the top here, you can see some very dramatic fractured ribs. So, does this video work? So they are very, very, very fractured. Our head's up this way, our tail's that way. You can see a step there, that's obvious. But with our non-displaced fractured ribs, you might just feel a little bubble of swelling. You might feel a little, what we say, crepitus, like the blowing bubble wrap. So tiny little crunchiness. Or the foal might seem painful where it just really shouldn't when you touch it. So that might need that we need to investigate more. If we're seeing these sorts of terrible fractured ribs, well, then we really need to get some assessment happening about how we're going to manage this foal. What about their heart or lung sounds? You know, we don't need to be a cardiologist to be very specific about what our location of our murmur is, what our rhythm's doing. But does the foal just sound really whooshy-whooshy? Are you hearing whoosh, whooshes in the heart? Are you hearing really irregular noises? Does it seem excessively high all the time, excessively low? Similarly, if you listen to their chest, does it sound like a bird cage? Can you actually hear air moving, or are you hearing squeaks, crackles, whistles, other weird noises that maybe we need to get a second opinion on from the vet? So then we move down to the abdomen. So next thing we'll check is the umbilicus. So in our first day, is it bleeding excessively? You know, does it just need a clamp, or does it keep bleeding and bleeding? Does it need maybe to be tied off in a different way or monitored? As they get a bit older, is it wet? Maybe do we have a patent urachus, or is it leaking discharge? So is it infected? Does it feel really thick and meaty as opposed to getting nice and small and dry? Or do they have any hernias? And if they have a hernia, is it just really small, or is it quite big? Just another thing to note in their record for something as they grow that we're going to have to monitor. If we listen to their gut sounds, we should just be hearing some regular gurgles, at least every 10 seconds in a foal. I don't think we need to worry about, you know, specific quadrants of what they do like we might in a colic adult. Is there nothing? So is there no noise at all? Or is it really, really loud and frequent and gurgly? Because both of those things are quite often an indication that diarrhea is coming if it's not there already. Speaking of diarrhea, does the foal smell of diarrhea but you can't see any? Is it a phantom squirter? If they smell bad, we probably need to keep an eye on them. Can we see any diarrhea on them? Can we see really, really hard, or those really like sort of gummy meconium-y balls that sometimes get stuck? So is our faeces going from meconium to nice pasty milk faeces, or is it something abnormal in between? Are they colicking? And they're also not forgetting that within our abdomen also lies our urinary tract. So are they passing urine that's a normal colour? Are they passing urine frequently? So we've got some nice big hernias for you here. So here we've got a scrotal hernia. Here we have a very large umbilical hernia. So, you know, they're often not this dramatic, but if you're seeing a big scrotal hernia, that's probably something you need to worry about. If you notice a little hernia in your neonate, watching as they grow for it to become a big hernia, if it's going to happen. Do we have diarrhea on the tail? You know, foals frequently can get diarrhea. So if they have diarrhea, then are we going to assess them further? Do they need a vet? Do they need support? Do they not? So what's their demeanour? Are they still nursing? Are they getting flat and lethargic? Is our diarrhea getting worse rather than better? If we see bloody diarrhea, like in this foal, then I would definitely be getting the vet out soon, because bloody diarrhea in our young babies can be very serious and we're better to get onto it straight away. Don't forget, if you're in a filly down this end of the foal, that looking at their vulva can actually be quite useful. It's just another mucous membrane that we can check. Talking of our urinary tract, looking at the foal's abdominal contour, so we already looked at a big blown up foal, so maybe its belly's full of urine, maybe it's full of gas or meconium. But what about if they're all jelly-like and they're getting this weird sort of jelly-like abdomen? That usually tells us that their kidneys aren't working. So if they're getting this sort of, you know, hanging down on the bottom of their abdomen, you touch it, it feels like jelly, well then that's an indication we need to do some bloods and to get them checked. This is the urine of a foal that had NI. So clearly that is not our light like water mild yellow tinge. That's very dark urine due to all the breakdown products of the blood. So now we're down to our legs. So I just like to touch the legs, number one. If the legs are really cold, probably we don't have good blood flow. Then we need to look for laxity and contracture. So if we notice some contracture or laxity, then actually really touching the leg, feeling the leg, where can we move it to, what's our range of movement? Do we have any angular limb deformities? So are we varus valgus in or out? Similarly, you might not address this right now in your neonate, but it's going to affect the foals management as it progresses. Do we have any swollen joints? And do we have any traumatic injuries to our limbs? So here we've got a foal with some laxity. So if we're looking at that, just making sure, even if the foal's going well, straightening up on its own, we're checking its heels, checking that it's not giving itself rubs, talking to your vet, talking to your farrier if we think we need to do some more, like put some little shoes or heel extensions on it. Looking at our contracted legs and assessing them every day. So how are we progressing? Are we relaxing well? Is that going well? Are we getting more contracted? Do we think we need some more intervention? Particularly checking those big foals that have been the hard dystocias. So this foal had a ruptured tendon, like its Achilles tendon. So you could actually completely straighten that leg out. You can just see it swollen up here. These foals can be very tricky because you don't notice this until they're really up and active and feeling better. So if it's been that difficult foaling, one of those ones where if the foal is down in the paddock, you do want to chase it up and watch it and make sure it's walking normally. This foal was being managed for some contracture and had a combination of it had been traumatizing itself, but also it had some bandages left on for quite a long time. So just really making sure, especially your newer staff, are aware that if they're bandaging foals' legs, those bandages need to come off every day. We need to look for wounds on the skin. We need to look for swellings on our tendons, so we can catch those things early. So then, there's lots of different tests we can do. If our foal's not normal, any of those physical exam findings are abnormal, then's the time really to talk to your vet. But things you can do, so we can submit a blood, so that tells us all about infection, our white cell count, might tell us about anemia if we're worried about an NI, tells us all about the internal organs, so are our kidneys working, what are our protein concentrations, is our gut losing electrolytes, all those sorts of things, and that'll just be different based on each foal. Like I said, if you've had a really high risk history, maybe this is something you are doing in that neonate to try and catch problems early. Otherwise, we'd only be doing this in our sick foals. On the farm, we might be able to check our lactate and glucose, so a good indication of how well the foal's hydrated, how well it's moving oxygen around its body, and how much energy it's been getting in the milk. Checking our IgGs, which I know you're all familiar with, but is interesting, I think, since these DVM stats came out, I think my first year in practice, so 14 years ago. The more you do them, the more you realise that a healthy, normal foal of a mare with good colostrum is actually like well over 11 or 12, and they're not just sitting on 7 or 8. So it can be quite interesting to see those numbers and notice trends within your particular foals. And then certainly just looking at that urine grossly, does it look nice and pale? But we can also check its concentration to make sure they're nicely hydrated. So then once you've got your vet involved, certainly they might do different things. So use the ultrasound, use the x-rays to diagnose different things in your sick foal, or to try and catch problems early. So if you've noticed the foal's a bit small and floppy, checking its ossification. So once we've done all these things, who should you call? When should you call someone? So if you're calling someone for help, that might be, the sort of top level of management on the farm. That might be your vet. That might be making the decision straight to hospital. This isn't one that we can wait and get the vet out. So if the foal's collapsed or if it's really lethargic, at the least, if it's lethargic, we're probably a bit dehydrated and need a bit of nutritional support, whether that's just down a tube or some IV fluids. If its heart rate, respiratory rate and temperature are really high, or at the other end if they're really low, which will be our collapsed foal. If it's off the suck or not nursing, because they don't have the big body stores, so they might just need a bit of help to kick along. If they're not passing urine or meconium, then we need to make sure that there's not a problem there with retention. If they have any random swellings or lamenesses, we need to make sure they're not septic joints or assess them if there's been any significant trauma. Anything else you notice, any lab abnormalities, and the moral of the story is if you think this isn't quite right, I wonder if I should check this out, call someone and ask for advice, because it's never wrong to do a bit more assessment, whether that's from someone else within your pool of HTBA wisdom, whether it's from your vet, whether it's from the hospital. If you think you need some more assessment of your foal, then contacting someone so we can get that done. So thank you for your attention, and do you have any questions? Yes.
What would you find the rate of success with your dummy foals?
So if we have a dummy, so just a dummy, not also septic, also NI, also other problems, so just a dummy, usually 80 to 90% of those will get better. Within that dummy foal, you know, we have a huge spectrum. So we say dummy because we think about their brain, but then also remember that other organs can be affected. So with our dummy foal, if we then start to have frequent seizures, that is a bad prognostic indicator. Our chances drop down from that 80, 90. If our kidneys aren't working and they don't start to work properly just with some fluid support, or if they get, say, significant meconium retention, diarrhea, all of that may drop those odds. But overall, dummies on their own have a pretty good success rate, and they're just really unpredictable, you know? They're going to need a little bit of help to find the teat in one day. Is it going to be a week later and we're still battling these problems as they develop?
If a mare has had a dysmature foal, is it likely to go there again?
Yeah, so our question has to be, why was the foal dysmature? So if it's, say, a situation where the mare was severely ill, had a bad colon torsion, the foal had some retardation of growth, no, probably not, that was a one-off. If the problem was because the mare has an issue with her uterus and placenta in that whole unit and blood supply and blood flow, well, maybe that might be a problem next season, and that's where you need to get your repro specialist involved. So I think it's very much situation dependent. No one else? Right. Thank you very much.